Welcome, everyone. My name is Dr. Donna Reece, and I'm joined now by Dr. LeBlanc. He has reviewed abstract number 414, which is the Ikema trial results, focusing on the depth of response and the MRD findings.
Thank you, Donna. Ikema is a phase 3 study comparing standard treatment KD to Isatuximab KD using this anti-CD38 monoclonal antibody for relapsed myeloma patients who receive 1 to 3 prior lines of therapy. 302 patients not previously exposed to Carfilzomib and not refractory to anti-CD38 monoclonal antibody were included. This presentation is an interim analysis specifically focused on depth of response and response kinetics. Response was assessed by an independent committee based on a central lab data and central review of imaging and bone marrow plasma cell infiltration. MRD was assessed on bone marrow aspirate sample by NGS with a sensitivity of 10 to the minus 5 in patients achieving at least a VGPR response.
What were the key take-home messages from your point of view?
Overall response rate favor Isatuximab KD with more patients achieving VGPR or better, 73% versus 56%, and CR or better in 40% versus 28%. For patients achieving VGPR or better, more patients obtain a MRD negativity result in 41% for ISA KD versus 23% for KD. Time to first complete response was faster for ISA KD, and patients continue to improve their response over around 12 months. As for many studies, those achieving MRD negativity had impressive PFS, both in ISA KD group and KD group. However, once again, more patients obtain MRD negativity for ISA KD treated patients. As Isatuximab may interfere with M protein assessment, mass spectrometry was performed for patients with IgG-kappa myeloma in potential complete response. Interestingly, after mass spectrometry adjustment, more patients were in CR from 40% to 46%, or CR plus MRD negativity results from 20 to 24%.
Canadian hematologists have a great deal of experience with Carfilzomib or K. From a perspective of a hematologist, how do you think these results might impact how we treat our patients?
For myeloma patients not refractory to anti-CD38 monoclonal antibody, ISA KD is certainly more attractive than KD alone or KCD used in the relapse setting. Although most patients are exposed to anti-CD38 monoclonal antibody at the time of Carfilzomib use, such as DRD, ISA KD represents a potential new standard of care for those patients never exposed. Without a phase 3 trial comparing anti-CD38 monoclonal antibody combined with KD versus with VD, the good result of a study like Ikema is influencing our choice, and with an access to this regimen in Canada for patients refractory to lenalidomide and not refractory to anti-CD38 monoclonal antibody, this study will change clinical practice in Canada for some patients at least.
Thank you very much.
Thank you.